There it is. How'd you do with that?
Okay.
Okay. A little sore on that one, right?
Yeah.
Are you noticing any difference with
Yeah.
it? What do you feel?
The pain is much less.
First things first, let's go ahead and just take a look at what we're doing here. Now, again, just kind of in terms of where you're feeling the back pain, where do you feel it at the most currently right now?
Right now here.
Right onto the center right there. Okay.
Here.
And you said it's been going on, I mean, you said, how old is your daughter now?
14.
Okay, so it's been about 14 years.
Almost 14 years,
Okay.
yeah.
And all she was doing, you just remember when she was younger, she was just bouncing up and down on your stomach,
Right.
just playing around,
Right here
right?
on the waistline.
And that's when you felt like the little, like clicking noise?
I heard it.
Okay.
Yeah.
All right. But it wasn't like immediate pain right after, right?
No.
Okay, it wasn't. How long was it till you said that you felt the pain shortly after?
Maybe a month.
A month after?
Yeah.
Okay. All right, let's see here. Yeah, based on your x-rays, definitely something was going on probably before that incident, but it's definitely been there for a long time, possibly 14 years. So definitely we see some wear and tear on there. So let's see if we can help to improve some of that stress there. Alright. And you mentioned that you had gotten an injection before. How long ago was the injection?
It was like about 12 years ago.
12 years ago.
Yeah.
Okay, let's see here. Now, when you feel the pain, is it more so when you're walking or is it when you're sitting?
Both. I can't sit too long and I can't walk too long.
Okay. Which position do you find the most comfort?
Laying down on the sofa.
Laying down on the sofa? Yeah. Okay. How long do you feel like you're able to sit before you feel like it's too uncomfortable?
You mean when it's bothering me or just like normal days?
When it's bothering you.
I'll say about like 5 minutes max.
Really?
Maybe I have to get it, otherwise my whole body gets like, it's like a stiff. Yeah.
So yeah, so right in here, that's your L5. This guy right there, sore right there?
Yes.
Yeah, right there. That's your L5. We're for sure going to be working on that, especially with your x-rays. We're seeing that it's shifting or dropping back like that. We're going to see if we can push that spine forward to see if we can alleviate some of that pressure on there, okay? Now we do have some stress on the top here as well. So 1, 2, 3, 4, 5.
Oh, that hurts.
6, 5. 5 is more. And then as we go a little bit lower here, let's take a look here. So this is C6, 7, 6, 7. 7, a little bit more in there. Okay. I'm going to go ahead and get you started with your neck, and then what I like to do is do your mid back, and then we're going to do the opposite. We're going to go do your lower back last, okay?
Okay.
All right. Let's bring that chin back right here. There you go. Dropping the shoulder on that left side. And all I'm going to do is give a little bit of a push with that left hand. This hand on the right is going to stabilize the neck just a little bit here. And relaxing the shoulder. Chin up just a little bit. There you go. Good job. How was that?
Feels good.
Good. Good. All right, now what I'm trying to do is once we get movement into the joints, we're going to try to get motion in them to try to pump out some of the inflammation there. Okay, and this is why after we're done with the visit today, walking is extremely important for you. And the reason why is because we're trying to get movement back into those joints so it can undo some of that stress.
Okay. Understood.
Just with that, with the neck, do you notice any difference, any goodness, any soreness? What are you feeling?
Yeah, I feel a little relief.
Okay.
Yeah, the stiffness was
a little bit less then?
Yeah.
Good. Good. Breathing in for me. Dropping the shoulders, letting it go. There you are.
Oh.
Good job. Yeah. All right. So that L5, that doesn't move very well at all. What it should be doing is it should be kind of gliding as I'm tilting you back. It should glide forward a little bit. What it does is it gets stuck because it's kind of shifted back a little bit. So we're going to get that L5. We're going to get that to move a little bit and see how that's moving too, okay?
Okay.
All right. There's that L5. Okay. Now I'm just going to give this right there a little bit of a push up just like that. I don't want to twist you like a pretzel, okay? I'm just going to kind of traction that shoulder up a little bit. I'm going to roll you all together. And it's going to give just a little bit of a push. We're going to just start off pretty light for your body, okay? A little bit of a push just like that. There you go. Dropping the shoulder. No? You're okay. A little bit more. There you go. There it is. How'd you do with that?
Okay.
Okay. A little sore on that one, right?
Yeah.
That really, that moved really well. I'm really
Okay.
happy with that. Good. And then just with that, are you noticing any difference with
Yeah.
that? What do you feel?
The pain is much less.
It's less? Okay,
Yeah.
good. Let's have a walk one more, maybe 2 more times. And come on back. Good. Good. So your job now is going to be getting a lot of walking in.
A lot of walking,
okay,
right.
one more time and we're going to have a seat and we're going to rescope that, okay? And come on back. Okay. How does it feel? Do you feel like it's a little bit looser? Or do you feel
Yeah.
like, yeah?
Oh, yeah.
Okay, good. Come on over. Now, there's a lot of work that we're going to need to do, and we're going to continue to work on that. But the biggest thing is there's some homework that you're going to have to do as we continue through the care, okay? We're doing our part, but it's such a small part compared to what you have to do outside the office, okay? And especially with monitoring some of the habits that we're going to be needing to kind of assess through your life, whether that be the way you pick up things from the floor, whether that be carrying your purse on one side, a lot of different things that we're going to be checking out. But right now, we're just going to do just the adjustment today. And as you go through care, we're going to assess to see how you do on some of the habits. With your lower back, as it shifts back like that, we're trying to push it forward.
Right.
When you bend at the back, it's almost like you push it back a little bit. And so we're going to try to keep that joint in that position for as long as we can. But again, we do a small part here. A lot of the work's going to be outside the house, okay? So just making sure we're trying to do the best that we can just to guard your back by not bending forward to pick something up. You want to bend at the hips and the knees. Or even in terms of a lot of times it really just comes down to just getting movement in the spine. You know, sitting for too long and slouching down like this, a lot of times that can create stress as well. So try to get some movement in the spine.
Just have my spine like straight.
Correct. Yeah, you want to try to keep a more upright posture here.
Posture,
Okay. But we'll walk you through. Right now, I'm just going to see how you do with the adjustment. Next time you come in, we'll assess how things are doing. Okay.
Okay.
All right. So there's three things I want you to do. One is if you feel any soreness, making sure you're icing for me. Okay. 15 to 20 minutes just to help to reduce some of the inflammation. 2 is going to be walking. 15, 20, 30 minutes a day if you're able to get out and do some walking, because now we're just trying to maintain and keep some movement in the joints here.
Right.
Okay? And then the last thing is, how's your water intake?
Oh yeah, my water intake is good.
It's doing well? Okay, good. We'll keep up the good work on that. It just helps to lubricate the joints in the body, but it also helps to flush out some of the toxins, okay? So keep your body hydrated, okay? But that's going to be it for today. Any questions for me?
No. So I cycle. So do I need to pay attention when I cycle?
Yeah, especially cycling. So remember how I told you when you're bending forward at the waist?
Right.
That's going to be a really big stressor on the back if you're bending like this.
Right.
So if you do cycle, you can still cycle, but you want to kind of maintain that arch in your back by bending forward, but keeping the pelvis moving forward, not necessarily bending at the back.
I got
here.
it.
Okay, so try to keep that in mind. Think of if you have those 2 metal bars in the back, keep that in mind that you want to kind of mimic that. You don't want to wear the back brace too often unless you need it. If you wear the back brace, a lot of times it creates dependency on the back brace instead of the dependency on your muscles. So we want to strengthen the muscles for you. Okay?
Got it.
So yeah, so just keep that in mind. Okay? Just try to keep that back nice and straight. Okay?
Okay, got
All
it.
right. Well, you're all set. We'll see how that does, and then next time you come in, we'll assess to see how things are doing from there. Okay?
Okay.
All right. Well,
Thank you,
keep up the
Dr.
good
Walker.
work. Yeah, my pleasure. Well, keep up the good work. We'll see you next time. So proud of you.
Thank you.
All right. Bye.